to ATS Underserved Community Scholarly Improvement Grant. She has given didactic teaching as well as clinical instruction to dental and dental hygiene students, with a focus on evidence-based dentistry and patient-centered care. She's currently in St. Louis, Master's clinical site, and she's in the partnership between the Master and Ophinia Healthcare, and she's teaching her students to provide comprehensive care to patients from many underserved and ethnically diverse communities. So welcome, Dr. Miller. I will open the stage for you. Please feel free to add to the introduction, and thank you for joining us today.
Thank you so much, Dr. I really appreciate you having me. I'm excited to talk about this grant-funded project, which would not be possible without the support of ATSU's internal grants. I was fortunate, like you mentioned, enough to receive the ATSU's Underserved Community Scholarly Improvement Grant, and that has just really expanded my project's reach. The project started in 2021. I will talk about the background a little bit so that you understand where the project has gone since this internal grant was applied. So thank you for the wonderful introduction. I wanted to say a little bit about myself, a little bit of a background and what inspires me to, help provide better access to care and communication to individuals who have limited English proficiency. St. Louis is a very diverse city. I will talk a little bit about our International Institute that we have here. I myself have benefited in my life from the services of organizations such as the International Institute. When I was 11 years old, my parents escaped the communist regime in Czechoslovakia, and I was a refugee. We lived in Austria in a refugee camp under a program for a year. And then we went to Canada under the refugee program where we lived 5 years. But I've traveled the world. And, I've had an experience as a refugee and as an immigrant. I later immigrated to the United States about 26 years ago. But as a child, 11-year-old child, not speaking English and coming to an English-speaking country, I was often faced with helping my parents navigate healthcare system. And it was hard for a child who doesn't understand medical dental terminology. My parents didn't speak much English. I learned English the fastest. Children learn quickly. So I would say about 4 months, I could speak conversational English. And so I really have a spot in my heart for this population and the language barriers that they face and how that affects their access to healthcare and communication with providers. So just wanted to share a little bit of data on the limited English proficiency individuals that reside in the United States. Over 65 million people in the US speak language other than English. About 26 million of them report that they don't speak English at all. There are about 350 languages spoken in the US, and I would imagine that increases with the increase in diversity. The study that I was looking at between 2010 and 2020 has seen a 6% increase in the diversity growth index, and I would imagine now it's even greater. Healthcare providers often struggle with provision of linguistically appropriate communication, and there are many reasons for that. There are a lot of organizational barriers. One of the biggest reasons is finances, lack of access to interpreters. Now this leads to, for the individuals that are affected by this that don't speak English, there's a decreased access to health services. Worsening of health status, increased risk of medical errors. Of course, the quality of care then is decreased, and there are also some studies that suggest that there is a increased risk for low oral health and health literacy. And Healthy People 2030 they have dedicated some of their report to, speaking about these issues among patients with limited English proficiency, and how the inability to understand health-related information and, inadequate communication can lead to low access and poor health outcomes. So, we have great diversity in the US. That is one of the things I love about living here. It is, like when I was little, they would say it's a melting pot of cultures and ethnicities, and everybody lives, side by side, loving each other and just appreciating the, opportunities that are provided by living in this country. And I am so fortunate that we serve this population here in St. Louis in our clinic. So I wanted to kind of describe what the diversity is like here in St. Louis and why. So first, before I do that, just wanted to go over a little bit of the background of my project that is now 3 years in the making. So I started this project in 2021 with a grant from the Lutheran Foundation of St. Louis. Lutheran Foundation has funds that are reserved for supporting the new incoming individuals that come in from other countries. So they have money set aside for projects that help, improve their lives. And so they were gracious enough to grant me some money to start Mosdo translation team. When I started working in this clinic here in St. Louis, I've noticed that we had a large number of people that came from different backgrounds, different ethnic and cultural backgrounds. And though we provide free interpretation services here, we had limited number of written materials in different languages. I initially, when I was thinking about starting this project, I was wondering whether I would have individuals who I can work with who would speak, all these other languages that we needed. Because our, diversity in the school of students and faculty is so wonderful, so rich, I was able to put together a team of bilingual dental students who are native speakers of their language. Some of them have even gone to dental school in those countries, alongside with bilingual speaking faculty from different countries, and was able to start developing written materials in different languages, as well as educational materials. So St. Louis, the reason why we're so diverse is because we do have the International Institute of St. Louis, which is one of the 10 VOLAG organizations in the United States. It's a wonderful organization that supports refugees and places them in our area, finds jobs for them, and provides other services. And it makes our city very welcoming to new refugees and immigrants that come into the region. So this is just a very short clip from one of the news channels I wanted to play.
Afghan family who has been stranded in Albania for months as war refugees are now in St. Louis. As Fox 2's Dan Gray shows you, they are beginning a new chapter in their lives.
Of all the passengers arriving at St. Louis Lambert International Airport, the Azimi family may have received the biggest welcome Monday.
He says he's very grateful and thankful to you guys for being here. He doesn't feel like he deserves all this warm welcome. And thank you to everybody who has worked hard to make this possible.
Mr. Azimi spoke through an interpreter. He, his wife, and 2 sons left Afghanistan under dangerous conditions after Kabul fell to the Taliban in August of 2021. Their first names were not released for security reasons. They still have family in Afghanistan trying to get out.
I don't know anybody in St. Louis besides the couple of folks, but what he has heard from the internet and what he has seen is that St. Louis has a welcoming culture for the refugees.
Mr. Azimi was a colonel in the Afghan army. He worked closely with the American military in Afghanistan. He said former Missouri Secretary of State Jason Kander, who served in the U.S. Army in Afghanistan, saved his life.
Mr. Azimi was a distinguished colonel in the Afghan National Army. He worked directly with U.S. service members, including a member of the United States Air Force, who helped Colonel Azimi create secret means of communication that saved many American and Afghan lives.
Prior to the Azimis arriving, community leaders held a news conference to assure them and other refugees that St. Louis is a community with open arms and open hearts.
And as Bosnian refugees did before them in the 1990s, Afghan families are making our city and our entire region a stronger and more vibrant place. Let's keep that spirit going. We want to ensure that they and all people seeking refuge in St. Louis have the full support. We support you, and we need you to have everything that you need to thrive as you begin this new chapter.
Since 2021, the International Institute of St. Louis has welcomed 724 Afghan refugees to the area. The Institute has plans to resettle about 1,000 more refugees in the St. Louis area. Dan Gray, Fox 2 News.
So we are very privileged to have, this diversity here. And in our clinic, we see many, many individuals who come from that community, alongside with many, many other communities. We have just in our building, looking at our reports, we have over 4,000 patients who speak over 45 different languages, who seek care at our St. Louis Dental Center. So the picture here you see is the clinic where I have my office. So I'm here most of the time. Sometimes I drive to Kirksville to teach the D1 and D2 students, but I'm mostly here in this clinic. And then I work on the clinic floor about 3.5 days a week. And then I'm so sorry about that. And then I also do research, and I work on my grant projects 1.5 days per week. This building here is the International Institute of St. Louis. It's about 5 miles from our building here. I have worked with them since 2013 on different projects. I started working with them when I was writing and implementing my thesis study. I worked with refugees speaking about 35 different languages, and I was investigating the effect of educational programs on the oral health literacy of refugees. Okay, so the inaugural team, most of the translation team looked like this. This was, 3 years ago when we got started. Many of these students, actually all of them, have already graduated. And many of them are still on board as volunteers and volunteer reviewers. So the individuals that are members of the team are native speakers of their language. I screen the individuals very carefully. And then they also go through a training program that I have designed. And we have a secondary level of quality control by working with faculty and other healthcare professionals speak that same language that the translator is translating forms to. And they do a second verification of accuracy. So we're very proud of the quality of our documents that we're creating. We are above the, quality control standards that are in the US for translation. Usually the only requirement for translation is that someone speaks and reads and writes a language. If that's the case and you're fluent, then you can translate, your own materials. There's no certification required unless you are a court interpreter or court translator. So we have gone above and beyond with our quality control, and very proud of the forms that we have developed. We also did a study with the users of these forms, and I'll go over that later. That is actually a part of this internal grant. The goals of this internal grant is producing new research from this underserved community. This is just an example of one of the forms that we've developed. In the past, the way we used to administer health history form is we had, a Spanish version of the form and then English version of the form side by side. It was much shorter than what we've developed as a part of the project. Now the forms are bilingual, so anyone who has a patient who, let's say, speaks a different language, somebody who has, let's say, an Arabic speaker, even though the clinician doesn't speak Arabic, because of this bilingual format, they're able to know what the patient is answering, what questions they're answering, and what the answers are. Of course, any follow-up that we have to any of the questions, we do involve interpreters, and we usually do remote interpretation using monitors in the clinic. So we started with 2 languages. When I came in here, there were 2 languages. We had some forms in 2 languages, maybe 3. At this time, we went from 3, 4 forms in different languages to 20 different forms in about 18 different languages. I see I have a typo here. I'm going to have to correct. Now, most of the languages are languages of the student doctor interpreters on the team. Some of the languages were in-kind donation, like our Portuguese form. That was in-kind donation from one of our faculty members who speaks Portuguese. And so they went ahead and helped translate that form. Okay, we also do, the translation team also does community outreach. So for example, one of our team members who just recently graduated from the medical school in Kirksville, she is actually from Afghanistan, from Kabul. And when I was initially looking for members of the initial translation team, the inaugural translation team, I remember I had a hard time finding a dental student in our school who spoke Dari and Pashto, which are the 2 official languages of Afghanistan. I reached out to the medical school side of things, and they found Zohal, who was very excited to join the project. She speaks both Dari and Pashto. She grew up in Afghanistan into her teen years. Her father was an interpreter for the U.S. military for about 5 years, and then they relocated to the U.S., and she ultimately made her way to the medical school and made her way to my team. So Zohal was helping with the Afghan refugees, creating educational materials and translating educational materials to Dari and Pashto. And then we participated in an educational program at the Institute where the mothers and their children kind of had a program, health and wellness program. And we brought coloring books, and Zohal, was educating them on oral health. Another event that was in St. Louis was Afghan Festival. I think they had about 300 people. We brought, again, education materials for children. We demonstrated, proper oral hygiene practices on models, and we dispensed, goodie bags with toothbrushes, floss, and toothpaste. Another big project that we're part of is we work with the Give Kids a Smile St. Louis organization. I don't know if you heard of Give Kids a Smile, but it's a program where children between the ages of 0 to 14 receive free dental care. This program began in 2001 in St. Louis and was later adopted by the American Dental Association, and now it's nationwide. So anyone who wants to put on a free dental clinic, it usually takes place twice a year. It's a 2-day clinic, can contact American Dental Association. They will send them materials to start up a free clinic. Now, because this is the original Give Kids a Smile, it's the biggest. And until about a year and a half ago, they did not have any funding or any participation of volunteer interpreters. So in November, last November, I became a part of the board of directors, and I designed a language access program for the Give Kids a Smile. We started with our translation team by translating some of their forms into different languages and helping with the language services. And we had about 10 people then. Now the team has grown along with our translation team to 50 volunteer interpreters from different universities. We collaborate with St. Louis University Department of Languages and Cultures, with the new dental school in Joplin, Missouri. We have some students who speak Spanish come up. They're going to come up and help interpret. It's actually coming up this weekend. So I've been very busy working with these 50 people and doing other things. So very busy, but it has been life-changing for all the volunteers that have never had, who volunteered and never had language assistance during that program. They said it's been just life-changing for them. And of course, for the children that come in that don't speak English and the families. So this time around, we have most of the children that are coming in speak Spanish. There's a lot of people speaking Spanish migrating to St. Louis. I think on Saturday, just the non-English speaking children, we have about 60 or 70 kids coming in just that day. And those are just the non-English speakers with languages ranging from Spanish to Swahili, Dari, Pashto. Of course, we have, children of the refugees coming in. This is one of the forms that we translated for the Tiny Smiles. It's a questionnaire that the Tiny Smiles program gives to the parents of 0 to 5-year-old children. It's a screening form. So that's how we kind of started with our project getting involved, but now we're really there in person and doing a lot of great things. So now to the grant, to the internal grant. The title, Student Doctor Translators, an Innovative Approach to Reducing Language Barriers to Patients with Limited English Proficiency. The languages we had at that time were Arabic, Dari, Pashto, Romanian, Spanish, Ukrainian. I'm sorry, Spanish is here twice. I'm going to have to correct there. And Vietnamese. Of course, now we have even more languages that we can deliver the research surveys in. Aim of the grant was to support the work of the translation team in creating clinical forms and educational materials to patients who don't speak English, and to bring awareness to communication barriers experienced by these underserved populations, and to examine effectiveness of innovative solutions through research. So there are 2 research projects that are tied to this grant. One project was to examine the perceptions of the patients with limited English proficiency on the effectiveness on bilingual forms that were created by our student doctor translators. And then the second research project stemmed from the results of the first one, and I'll go into that in a little bit. It is a multilingual assessment of oral health literacy, and also looking at the impact of chairside as a patient educational tool. So the first project was, we looked at how patients who don't speak English perceived our translated forms. And the questions ranged from the difficulty, how well the forms were, how well they read the forms, if they understood the dental and medical terms on the forms, and how that influenced their overall understanding of the form. Also, did they feel like the forms needed any improvement? Did they feel like the provision of these forms helped them have better experience as far as patient-provider communication, and also their overall stress level, getting dental care? Did these forms help ease their stress level or lower their stress level? So we've had some really good results. As you can see here on the 2 charts, how helpful was the form for the communication, and most felt that it was extremely or very helpful. And then how much more comfortable were the patients receiving dental care after having been supplied with the translated forms. And as you would expect, the results were also wonderful. They felt much more comfortable, or a great deal more comfortable, than if they wouldn't have had the translated form. Now, one of the things that we found out in our study was that a lot of these patients answered that they did not understand the dental and medical terms very well on the forms. It wasn't everybody, but a big majority of them. So that had me thinking about, what are we going to do about this? So we have patients who are coming in, speaking other languages, and even though we give them translated version of our forms, they don't understand terminology, right? Dental terminology. So just thinking about health literacy in general, if you ever looked at research, this was the topic of my thesis. Only 50% of US residents understand health-related information adequately, right? So usually people have low health literacy, and it is even lower with people who don't understand the language, right? Somebody who's communicating with their provider who doesn't understand English very well is probably not going to understand the terms, the lingo, the medical dental lingo that's being used. Now, I found in my research with my thesis that even if the terms are presented in their language, they still don't understand all of the terms, right? So we needed some way to improve that. And that's how I came up with this project where I asked for funding in order to be able to deliver assessment to these individuals and help improve their oral health literacy. So this is the pilot phase of that study. So the idea I came up with was to create an oral health literacy assessment survey of the 50 most commonly used dental terms in our clinic and provide the patients with 4 multiple choice options for the definition of the term, okay? So then I used the fund from the internal grant to purchase electronic tablets. And we created the survey on Qualtrics, right? So these are the tablets. They're very heavy duty, so we can have them chairside. The patients can just use them. They access the pre-test survey on Qualtrics. They go through the 50 dental terms. We do have now the surveys in different languages. So for those individuals who speak, let's say Spanish, they take the test in Spanish. Then we get immediate feedback from Qualtrics as far as the terms that they did not know. So let's say out of 50 terms, they don't know 10 or 20 or 30 terms. The student then, the student doctor, will give the patient a link to a educational component. The educational component includes 50 slides. Each term is dedicated to 1 slide. On this slide is a definition of the term. There's a video about the term. So let's say we're talking about amalgam, silver filling. There's a video of amalgam with narrative. It's about 1.5 to 2 minutes long. And it's also in audio. So for those individuals who don't read very well in their language, we also transcribed the narrative of the video, and our translation team recorded that narrative in that language, and then we uploaded the audio next to the video on the slide. So they can push on that. For example, if they can't read the definition or they don't hear the video very well, there's transcription as well as audio. So we always have transcription on the next slide that they can read. So it's for people who either can't read or can't hear very well. So this is one of the individuals taking the survey on Qualtrics. These were the criteria of the study, 18 years or older. At that time, we didn't have the educational components translated into all these different languages that we do now. So we did the pilot study in English. But these were the results, pretty great results. Everybody had improvement in their oral health literacy after completing the educational components. This is what the educational component looks like for each term. So this is now the version we have translated to Spanish, and then this is the Farsi, I believe. So what we're doing now, this is still under the internal grant, is the interpreters or the translators are converting 50 slides, 50 educational component slides to different languages. And we are just getting ready to start collecting more data for more diverse patient population speaking different languages. So this is PULP. So this is a video that talks about PULP, and it's in English. So what we did is we transcribed the audio, And then this is the recording of the audio in a different language. So when I play this video in English, I can mute it. And at the same time, I can play the Farsi version of what they're saying here. So and this is, again, audio for the definition right here. And then we do a post test. So after the patient chairside goes through the slides of the terms that they missed, then we do a post test. Okay, so what is the vision for the future? So my vision is to continue utilizing the funding to support the work of the translation team, to expand our projects, Study 1, Study 2, to other ethnic groups and languages. We have expanded beyond the Arabic and Farsi and Spanish. There's also Vietnamese that we just started translating. And then our opportunities for new study under this grant. So my team is currently working on developing content for a website that will be housed on the ATSU website. It'll be one of the tabs. And that website will have all of our forms that we have translated into different languages. It'll be available to clinicians across the US and the world. So for example, somebody who is in Madrid in Spain and has a lot of expats who don't speak Spanish, they can use our bilingual forms and administer those to their patients. Also, of course, there are many, many offices here that see diverse populations in the US. And most offices don't provide forms in different languages. If they do, it's mostly just in Spanish. So they'll be able to access the website and download our forms and use them in their practice. Another section of that web page will have a link to that oral health literacy assessment survey and link to the educational components for the terms. So clinician can educate their patient, assess their oral health literacy, and then help educate their patient through the website. Another thing we're going to have on there is another tab that will have resources to events like Give Kids a Smile, where free dental care is provided for children speaking other languages and where interpretation is provided free of charge. There are a lot of different things we're doing with this website, but the content that we're developing, all of that needs to involve the translation team. They are, central at developing the materials and the content for the website and making sure that the accuracy of what's presented on the website is, top notch. So, one of the things that I discussed with the website developers or with our marketing department that facilitates the website developing with the developer is that we can't just use Google Translate to translate the introductory content, for example, on the web pages, because as we know, Google Translate is only partially accurate. So to kind of test that, I clicked on, because I'm from Czech Republic, so of course my native language is Czech. So I clicked on the Czech version of the web page and I'm like, okay, I was just looking at the ATSU website and I'm like, okay, well, this was not correct and this was not correct. So it's going to be great having our translation team kind of make sure that the quality of whatever is, written on the site and the materials is good. Another opportunity for future studies to increase the literature that we have on this diverse population out there is to collaborate with the International Institute of St. Louis even more. I can see our team of interpreters creating educational programs for individuals coming from different countries, speaking different languages. Culturally appropriate content is also very important. So because our translators are, from those cultures, they can really do a good job developing adequate, really good programs. They have an intake program. The International Institute has an intake program for refugees where they go through health screenings. I would love to see us get involved in joining that team and doing dental screenings, for example. And again, having our translation team a part of that, providing forms in different languages. And then, provide more language assistance to community nonprofit organizations that are increasing access to care, like the Give Kids a Smile. So far, we had funding to help them develop some materials from the Lutheran Foundation, but we don't have funding under the internal grant to provide assistance with materials out of our clinic in general. So I would love to get more funding to help them translate all of their documents, all of their intake documents, not just the, Tiny Smiles for the Tiny Smiles program. So there are a lot more opportunities I can think of, but I would take too long. So anyway, I think we're at the end of the presentation. I would love if anybody had any questions, if I can clarify anything or anything at all that you'd like to ask. Yes,
That was awesome, Dr. Mueller. Thank you so much. It's fascinating work that you're doing.
thank you.
Quick question. How many languages do you speak?
So I speak fluently, of course, Czech and then English. And when I lived in Europe, in between migrating to the US and being a refugee, I lived in Europe for a little while. So I had some German and Russian. So like 4 years of German and Russian, but I don't use those languages a lot. And when you speak another language, especially if you learn it in school, you have to practice. So it's on my to-do list. One of these days, I don't know when that's gonna be, when I'm not gonna be busy all the time with my work that I'm doing here. And I want to take those up. I want to refresh my memory of the Russian and the German, and I want to get better. And I also love to learn Spanish.
Awesome. Thank
Thank you
you.
for the question.
Thank
I
you,
do want to
Dr.
say about the Give Kids a Smile. So the first time that our team participated in the event in November, when we provided language assistance to these families that come in who don't speak English, the most rewarding moment for me was when I saw a parent in line with their child, and the parent didn't speak English, and you could see this like look of worry on their face. Like my parents used to have that look on their face. It's like this worry that your child is not going to get the care that other children get, that you will not be able to understand what's going on with your child or communicate your concerns. It was this look of just worry. And when they approached my check-in area, and I called the interpreter over, who spoke their language, you just saw this relief, like this stress leaving their face, and this huge smile. It was just priceless. And this just makes such a big difference for these individuals, because I was there. I know what that feels like. You're in a strange country, in a strange culture. You're excited because you have freedom and you have opportunity, and that there are people who want to help you. But still, it's just that there's this disconnect. And if somebody comes and at least speaks few sentences in your language, it's just this like connection. And so that's the most rewarding thing that I think that we get as far as our team of interpreters and translators, is that knowing that we're making that difference. And because the students and faculty, whoever's helping with the interpretation, they were, either their parents or they themselves were in those shoes, where they were, foreigner in a new country. So yeah.
Thank you, Dr. Muller. That's just amazing what a resource you're creating, not just for your neighbors, but the whole world over. There's just like so much potential for, that's just amazing. So
Thank you for
that's
saying that. I had this vision a long time, like for a very long time, before I had the opportunity to actually begin the project. The clinic opened here in 2015, and I saw the need, and I guess the timing wasn't right until 2021, but I was so grateful, and I'm grateful every day for being a part of this university and having the opportunity to do something like this. And of course, I couldn't do it without my team. I could never do this without the students, the faculty, the support of sponsored programs, just of you guys, just everybody who's been, a part of this project in one way or another. There's no way I could have done this, if that support wasn't there.
Absolutely. We all need to learn from that and use and seek help from our colleagues. I do have one question for you, Dr. Muller. So, do you have data that will support that, with this with this intervention, like oral health will improve over time?
So the oral health literacy part of this project, we've done the pilot study. We didn't do the administration of the assessment to foreign speaking individuals. We're getting ready to start doing that. It just took a while to get the tablet set up and then the Qualtrics set up, do the pilot study, develop the translated versions. So what we're going to have to do at the, initially is to look at the improvement in oral health literacy. And then we're going to have to do some tracking over time of these patients and perhaps look at their plaque index, which is assessment of biofilm, and then see if that has improved over time. So we're going to have to start, incorporating that. That's a very good question and a good point. Thank you so much.
Dr. Morgan has a question for you.
Yes.
Thank you for that interesting presentation. I don't know if you addressed this or not, but have you published any of your research? And if not, where are you considering
So
publishing
I
it?
published, so the first study where we assessed the perceptions of patients utilizing our translated forms, I published that in the BMC Medical Journal. And let me see if I can access that and put a link in the chat. Yes, and then let's see. Let me see if I can just do a quick search. Okay, let me put the link in the chat. There you are. So this was my part of my dissertation work. But yeah, I utilized the data from the study, and it had some wonderful results. So I am going to do a follow-up, like kind of like a second study where we're going to have more languages included after the project is over. So the internal grant project is funding is running until June of next year. So I'm going to wait until we have data, until June. And then I definitely can, there's lots of journals that I can approach to publish the work in. Good question, thank you. And as far as the oral health literacy survey and assessment, so far we have presented our findings in the research day presentation at MOSDO, which is once a year in April. So there are, we presented data from different phases of the study, or I think in the last 2 or 3 years. So, when that all comes together with all the different languages that we're going to be administering our surveys and patient educational components, and definitely going to want to publish that as well. Actually, one of my students from one of the teams is going to be presenting part of the data. Hopefully she'll get accepted at the IADR conference. I believe that's on the East Coast in the spring. She has submitted an abstract. So we're slowly trying to disseminate as much as we can. Thank you for the question.
Would you say this concept is highly adaptable to all health professions?
Yes, I think it could be adapted. I do have to say that it is a work that requires a lot of dedication. I have a lot of experience with translation interpretation when I lived in Europe before I came to the US. And I think it would require somebody like me who's, knowledgeable in that field. And, I am supervising basically 11 students, okay, doing this basically as a kind of like a work study where they have to juggle school, exams, patient care, and then they have to fit in work, for the translation project. It has to be flexible. One of the nice things about this project is that it is flexible. They complete their translations online. So I have everything organized in a Google folder that has so many subfolders. I have to create training. I have to be on top of their translations. And, even once they're done with the translation, you have to go through the formatting of the forms. So it's hours and hours and hours of work and dedication and communication with the students, making sure that the forms are updated. For example, our, vice dean informed me, a few months ago that she'd like to change some questions on the health history form. That requires me contacting the whole team of translators, even our alumni. Like, for example, one of our alumni who's from Ukraine, I don't have another Ukrainian translator, so I have to contact him and say, okay, we're going to be changing 2 questions on the health history form. So, the English version of the health history form is only the start. That's the easy part. Then you have another, 11 languages where you have to change the question and change the translation, but also some of the languages like Arabic, because of the spacing of the letters or the width of the letters, that throws off the formatting of the form that we're trying to keep to 2 pages. So then that takes another time to try and work with the translator and trying to format the form. So there are so many moving parts. So I do think that this could be utilized in other settings, in other maybe institutions or programs, but it's it would require probably some training, maybe observing of what I do and then trying to implement it. But I don't think anything is impossible. So absolutely. Yeah. Any other questions? Well, I enjoyed, presenting about my research, and I hope you enjoyed listening to it, to my presentation. And, if I can again present in the future on some topics, let me know. Thank you
Yes,
so much.
absolutely. Yes, would definitely want you back and, tell us more about, your like the second project that you're going to start. And,
I
we
would
are
love
on.
to come over maybe when the website is complete to go through the website so that people know how to access it and how they could utilize the website. That is kind of the final phase of my project, which, one of the things that I didn't mention is that I don't want this website to ever go away. So I want it to be maintained. So in order to maintain the website, we're going to need ongoing support and funding. And I'm going to have to be involved in this project for a very long time. So, which I'm looking forward to. But yes, the website is kind of the end of that first big part of the big 3-year project, but then the maintenance and the ongoing development and just improvement of the site. And, I want to collect data from the website. I want to look at user profiles. I want to look at what languages were used the most, which, from which countries or which states these providers are, and what patients, benefit, like, who benefits from the website and the resources there.
Thank you for your presentation. We
Thank
will see
you.
you some other time and hopefully
you.
soon.
Yeah.
And this is, just what you're doing God's work.
Oh,
You
thank
really
you
are
so
doing
much.
God's
I
work.
appreciate that very much. I
So,
do. Thank
yeah.
you. I know we're making these children's and families' lives better and patients' lives better. I know that, and that is all it's about, right? And we want to provide the resources that help improve communication, because we want to provide, the best quality service and care to these people.
Great
Yeah,
job. Thank you.
so much. Enjoy your day, everybody.
Yeah.